Imagine a world where hundreds, maybe thousands of animals are living, incredibly close together. Now, think about the tiny invisible battles happening every single day inside that environment. We're talking about the sheer scale of modern pig farming and the often hidden challenges that pop up when so many lives are so intertwined. Did you even know that some conditions in these animals can actually mirror or sometimes directly influence our own health?
Human health. Welcome to the deep dive. Today we're digging into a whole stack of sources about pig health. Everything from specific bacteria, environmental factors. We're going to pull out the most important bits, the surprising facts, just for you. Our mission, give you a shortcut, really, to understanding what actually matters in this often overlooked area.
Yeah, in pig health, it's definitely not simple, as
Uh,
our sources make really clear. It's this dynamic interplay, between the pigs, their environment, and like you said, a whole host of tiny invaders. A lot of the really severe outbreaks, they aren't just one thing. It's often more like a cascade effect,
hmm.
where one problem kind of paves the way for the next one. Okay, so let's paint that picture then. These modern intensive swine production systems, what does that environment actually look like? How does it create challenges?
Well, you're looking at really high animal densities, often hundreds, sometimes thousands of pigs packed into enclosed facilities. And the sources really hammer home how critical the environment is here. Things like ventilation, temperature, humidity, even ammonia levels,
Yeah.
they can all create significant stress.
Right.
And that stress weakens their defenses, basically turning these places into, well, superhighways for disease to spread.
And the stakes economically and for animal welfare, they're huge, aren't they? It's not just about a few sick pigs.
Oh, absolutely. Swine diseases are a massive constraint on the whole pork industry. You've got the direct costs, mortality, vets, medicine, obviously, but the indirect costs are often even bigger. We're talking things like reduced growth, poor feed conversion, taking longer to get to market weight. Just as one example, the reports we looked at estimate Mycoplasma pneumonia, that's a major respiratory bug, costs the U.S. industry somewhere between $375 and $400 million
Right.
every year.
Wow. That's just staggering.
It really is.
So how does understanding this idea of primary versus secondary pathogens help us make sense of those costs and, the whole disease picture?
It's absolutely fundamental. Think of primary pathogens as the initial attackers.
Yeah.
The ones that can cause disease all by themselves. They damage tissues, they weaken defenses. They're the ones breaking down the door, so to speak.
Okay.
Mycoplasma pneumonia, which I just mentioned, or swine influenza virus, those are classic primary pathogens.
So once that primary pathogen has, created an opening, what happens then? How did these secondary guys jump in?
Well, they're often opportunistic. These secondary pathogens, they're frequently just normal inhabitants living in the animal without causing any trouble, usually.
Right, they're already there.
Exactly. But they seize the opportunity presented by the damage from that primary infection. They invade deeper, and that's when you see really severe disease. Pastorella multicida or Streptococcus suis are really common examples here.
Ah, I see. So this synergy, this teamwork is crucial. The source is stressed that the outcome when you have both together is often way worse than either one alone.
Far worse.
So like you said, treating just that secondary infection, it might feel like you're doing something, but it's really just a symptom fix if the primary guy is still active.
Precisely. You're not getting to the root cause.
Okay, let's dive into some specifics then. Starting with the respiratory system, this porcine respiratory disease complex, or PRDC, and right at the heart of it, you mentioned Mycoplasma pneumonia. You called it a keystone pathogen. What makes it so central?
Well, its biology is pretty unique. It's one of the smallest things that can replicate on its own, and crucially, it lacks a cell wall.
No cell wall.
Yeah, and that's a big deal because common antibiotics, like penicillin, they work by targeting cell walls. So Mycoplasma is naturally resistant. It's also really tricky to grow in the lab, very fastidious.
Yeah.
So for diagnosis, PCR testing is pretty much the standard now.
And how does it actually cause disease? What's it doing in the lungs that makes it such a key player?
So it specifically attacks and destroys the ciliated epithelial cells. Think of these cilia as like tiny hairs forming the lung's natural escalator.
Okay.
They constantly move mucus, debris, and trapped pathogens up and out. When Mycoplasma destroys that escalator,
Cleaning system breaks down.
exactly, the lung's defenses are seriously compromised. And that creates the perfect open door for all those secondary invaders we were just talking about.
What would a producer or vet typically see? What are the signs?
Often, it's a chronic, kind of dry, hacking cough. It's non-productive, meaning not much mucus comes up. You especially notice it when the pigs get stirred up or exercise. And then on postmortem, you see these very characteristic lesions called cuffing around the airways. That's a big clue.
We talked about the huge cost. Are there effective ways to control it? Strategies that work?
Yeah, its cost is right up there.
Yeah.
Second only to another virus called PRRSV. And like we discussed, co-infections just multiply that cost hugely. You know, that Mycoplasma plus swine flu combo can cost over $10 per pig.
Wow.
So for control, all in all out management is key.
That's emptying and cleaning barns completely between groups.
Exactly. It breaks the transmission cycle. And vaccination is also really important. It doesn't always prevent infection, but it significantly reduces the severity of the disease.
Okay. And speaking of those opportunists, you mentioned Pastorella multicida. Where does that fit into the respiratory picture?
Right, Pastorella. It's actually a very common resident in the upper respiratory tract of healthy pigs. Doesn't usually cause problems on its own, but when other pathogens, especially Mycoplasma, have already damaged the lungs, Pastorella can invade and cause severe trouble. We're talking severe inflammation, often leading to what's called febrinous bronchopneumonia, basically sticky inflammatory deposits in the lungs, and sometimes pleurisy, which is inflammation of the lining around the lungs.
So the real strategy for Pastorella is actually managing the Mycoplasma or other primary issues first.
You got it. Control the primary damage, and Pastorella usually stays in check.
Now, you mentioned a synergistic story with a sort of happy ending, progressive atrophic rhinitis, PAR. What's the team up there, and why is it a success story?
PAR. Yeah, this is a great example of how we can win against some diseases. It involves two bacteria working together. First, Bordetella bronchosepica causes some initial damage to the lining of the pig's nose. That sets the stage for certain strains of Pastorella multicida, different from the pneumonia ones that produce a really potent toxin called PMT.
And this toxin does?
This PMT toxin is nasty. It directly attacks the cells that build bone and stimulates the cells that break bone down.
Yeah.
The result is irreversible destruction of the delicate bones inside the nose, the turbinates. In young pigs, you'd actually see their snouts start to twist or deviate to the side.
Ooh. Okay, so the happy ending part.
The happy ending is that PAR is actually rarely seen in most modern pig operations today.
Really? Why is that?
Primarily because of really effective vaccination programs for the sows. The immunity gets passed to the piglets through colostrum. Combine that with generally better management practices, and this disease, which used to be a significant problem, has largely been controlled. It's a real testament to proactive health management.
That's great to hear. Okay, switching gears a bit, still respiratory, but with a broader implication. Swine influenza virus, SIV. This one connects directly to human health, doesn't it?
It absolutely does. In pigs, SIV is highly contagious, spreads like wildfire. You see high fevers up to 108 Fahrenheit or 42 Celsius lethargy, pigs off feed, and this characteristic deep barking cough. But here's where it gets really critical and, frankly, a bit concerning for public health. Pigs are often called mixing vessels for influenza viruses.
Mixing vessels.
Yeah, they have receptors in their respiratory tracts that can bind to avian flu viruses, human flu viruses, and swine flu viruses.
So they can get infected by strains from different species.
Exactly. And if a pig gets infected with, say, a human flu virus and an avian flu virus at the same time, the genes from those different viruses can actually mix and match inside the pig's cells. It's called reassortment or antigenic shift.
And that creates new viruses.
It's totally new strains, potentially ones that human immune systems have never seen before. This is precisely how pandemic strains can emerge.
Yeah.
The 2009 H1N1 pandemic virus, that originated from a complex reassortment involving swine, avian, and human flu genes that likely happened in pigs.
Wow. So pigs are literally a potential source of new human pandemics. That's quite something. How do you manage SIV on the farm then?
It's tough. There's no specific antiviral treatment for pigs. So control mainly focuses on supportive care, keeping them comfortable, hydrated, preventing secondary bacterial infections, which are common after flu, and really strict biosecurity to limit spread. Vaccination is used, but it's challenging. The virus evolves constantly, kind of like human flu, so vaccines need updating. Plus, maternal antibodies from the sow can sometimes interfere with how well the vaccine works in young piglets.
Okay, let's move beyond the lungs now. Systemic and enteric issues. First up, Streptococcus. You said it goes from being a normal inhabitant to sometimes lethal, and it's zoonotic. Tell us about that range.
Yeah, Streptococcus, it's a major player, especially in pigs just after weaning. But like Pastorella, it's often just a normal resident of the tonsils and nasal cavity in healthy pigs. Stress is a huge trigger, things like weaning, mixing pigs, transport. Those stresses, along with co-infections, can allow strep suis to invade the bloodstream.
And when it invades?
It can cause really devastating effects, primarily septicemia, that's blood poisoning and meningitis, inflammation of the brain lining. This leads to dramatic neurological signs. Pigs might lose coordination, ataxia, paddle their legs, have involuntary eye movements, that's nystagmus, or develop head tilts. It can also cause arthritis in multiple joints, called polyarthritis.
And the zoonotic risk, you highlighted that.
Yes, this is really important. Strep suis has significant zoonotic potential. Humans can get infected, usually through contact with infected pigs or handling raw pork, especially if there are cuts or abrasions on the skin.
Who's most at risk?
People working closely with pigs, farmers, vets, slaughterhouse workers. And the most common and frankly most devastating outcome in humans is meningitis.
Yeah.
And what's particularly tragic is that strep suis meningitis in humans often leads to profound bilateral, meaning both ears, and permanent hearing loss.
Permanent hearing loss. Wow. That raises a serious question, doesn't it? How aware are those high-risk groups about this specific danger? It feels like something people should really know about.
It's a critical occupational health issue. Awareness is key.
So how is it controlled on the farm, given this serious potential?
It's challenging. Prevention is the main focus. Reducing stressors around weaning is huge. Good ventilation, strict sanitation are also vital. Antibiotics are used for treatment, but like with many bacteria now, antimicrobial resistance is a growing concern, making effective treatment harder and prevention even more critical.
Okay, next up, a really dramatic one, edema disease. You described it as the perfect storm hitting the best pigs. What causes it, and why that particular group?
Edema disease is caused by specific strains of E. coli. These strains have two key features: special little arms called F18 fimbriae that let them stick to the pig's intestinal wall, and they produce a very potent toxin called shikatoxin 2E, or CCX2E.
And this toxin gets absorbed.
Yes, it gets absorbed into the bloodstream and damages blood vessels, particularly small arteries and arterioles. And the twist, the really striking thing, is that it typically hits the healthiest, fastest-growing pigs in a group, usually about 1 to 2 weeks after they've been weaned.
Why them? Why the best ones?
It seems to be this perfect storm, like you said. Weaning itself is stressful. Their diet changes dramatically. Their immunity from their mother's milk is starting to wear off. This combination creates a window of susceptibility, and somehow the most robust pigs seem most vulnerable to this specific E. coli strain taking hold and producing toxin.
And the signs are pretty sudden and severe.
Very sudden. Often, pigs are just found dead, no prior signs. If they're found alive, the classic sign is that subcutaneous edema, swelling under the skin. You see it most obviously in the eyelids, forehead, maybe the snout. They also often show neurological signs, incoordination, maybe lying on their side, convulsions. But interestingly, diarrhea is not typical, and they usually don't have a fever. Mortality in affected pigs is extremely high.
Sounds devastating. What can be done about it? Control, prevention.
Yet once the clinical signs appear, treatment is often pretty futile, sadly. The damage is done. So prevention is absolutely key. A lot revolves around nutritional management right after weaning. Things like temporarily reducing protein levels or increasing fiber in the diet can make it harder for that specific E. coli to flourish.
And importantly, there are now effective vaccines available that target either the F18 fimbriae, preventing attachment, or the Shiga toxin itself.
Any other angles?
Yes. There's also a fascinating long-term strategy involving genetics. It turns out some pigs have a natural genetic resistance. They lack the specific receptor called FUT1 that the F18 E. coli needs to attach to the gut lining. Breeding for this resistance is another tool in the box.
Okay, this next one sounds completely counterintuitive.
Yeah.
Salt poisoning, but really water deprivation. A killer, but not for the reason you'd first think.
That's right. This is a really important one to understand because the name is misleading. The root cause is almost always inadequate water intake. It's not usually about too much salt in the feed itself.
So what stuffs them drinking? It could be anything. Clogged, water nipples, frozen pipes in winter, overcrowding so dominant pigs keep others away. Maybe just simple human error, like forgetting to turn the water back on after maintenance.
Okay, so they get severely dehydrated. But the really dangerous part, the paradox, is when they get water again, right?
Exactly.
Yeah.
This is where the pathophysiology gets really interesting and kind of scary. When a pig is severely dehydrated, sodium levels build up in its body, including in the brain tissue. Now, if that pig suddenly gets access to unlimited water...
It'll drink loads fast.
Right. It drinks rapidly. This quickly dilutes the sodium in its blood. But the sodium that accumulated inside the brain cells can't get out that quickly. This creates a massive osmotic imbalance. Water follows solutes, right? So water rushes into the brain cells to try and balance the sodium concentration.
Causing the brain to swell.
Exactly. Severe brain swelling, cerebral edema. This leads to the characteristic neurological signs. Seizures, often with this peculiar dog-sitting posture, maybe snout twitching, or the head jerking backwards, called opisthotonus. And sadly, it often leads to death.
So the very act of trying to help by giving unlimited water is actually what can kill them.
Precisely. It highlights this really crucial point. The high mortality rate in these cases is often iatrogenic.
Meaning caused by the treatment itself?
Yes, caused by a well-meaning but incorrect approach. It really makes you pause, doesn't it? How many other things in animal care, or even human medicine, might have these counterintuitive dangers if we don't fully grasp the underlying biology?
It's a sobering thought. So management is all about
Prevention, prevention, prevention. Daily checks of all water sources, making sure they're working, accessible, providing enough flow is absolutely critical. And if you do find dehydrated pigs, the treatment involves slow, gradual rehydration over several days. Never just turn on the taps full blast.
Okay, let's pull back a bit and look at some themes that cut across all these diseases. First, biosecurity. You mentioned it briefly, but its role seems paramount.
Oh, absolutely paramount. It's the first line of defense, always. Biosecurity is fundamentally about preventing pathogens from getting onto the farm in the first place and preventing them from spreading if they do get in.
What does that look like in practice?
Key principles include things like establishing a clear line of separation, basically a boundary between the outside dirty world and the inside clean farm environment. Strict rules for people entering, maybe shower-in, shower-out procedures on high-health farms, providing farm-specific clothing and boots, controlling animal movement, minimizing introductions, quarantining new animals, thorough cleaning and disinfection of vehicles entering the site, and rigorous pest control. Rodents and birds can carry diseases too.
So it's really about building fences, both literal and procedural, to keep disease out and contained.
That's a great way to put it. Health starts with exclusion and containment.
And nutrition clearly plays a role too, beyond just growth, right? We touched on it with edema disease.
Definitely. The sources emphasize how diet directly impacts susceptibility. We saw how high protein post-weaning can be a risk for edema disease, but it goes broader than that. Vitamin or mineral deficiencies can impair immune function generally. And things like mycotoxins, toxins from molds that can grow on feed ingredients, can suppress the immune system, making pigs more vulnerable across the board.
Okay, so with all these overlapping signs, coughing, neurological issues, diagnosing specific diseases sounds really challenging. What's the approach?
It absolutely is complex. You rarely diagnose based on just one sign. It requires integrating multiple pieces of information. You need a good clinical history from the producer. Careful observation of the pigs is critical, looking for those subtle differences in neurological signs, for instance. And honestly, necropsy, doing a post-mortem examination, is incredibly valuable. Finding those characteristic lesions, like the lung cuffing and mycoplasma or the brain swelling and salt poisoning, is often key to confirming a diagnosis.
Right, like using that table, we saw differentiating neurological signs, presence or absence of fever, edema. That dog-sitting posture helps distinguish between things like edema disease, salt poisoning, and strepsus meningitis.
Exactly. It's about putting all the puzzle pieces together. Clinical signs, history, post-mortem findings, and sometimes lab tests like PCR or culture.
Looking ahead then, what are the biggest ongoing challenges, and maybe where's the hope? What's coming down the pipeline for managing pig health?
Well, one massive global challenge is antimicrobial resistance, AMR. It affects human and animal health, and the swine industry is definitely impacted. There's huge pressure, rightly so, to reduce antibiotic use. This means we desperately need effective alternatives.
So where's the research focused?
There are several promising areas. Developing novel vaccines is a big one, vaccines that offer broader protection or find ways around that maternal antibody interference problem we talked about with SIV. There's also a lot of interest in the microbiome, using probiotics or prebiotics to help establish a healthy gut flora that can resist pathogens. And another fascinating area is antivirulence therapies. Instead of killing the bacteria directly, which drives resistance, these aim to disarm them, block their toxins or their ability to attach, for example. That could be a game changer for reducing resistance pressure.
And finally, just to circle back to where we started, really, this One Health idea seems absolutely central to everything we've discussed.
It truly is. The connections are undeniable. We talked about the zoonotic potential of strep suis causing meningitis and hearing loss in people. We talked about swine flu and its role in potential pandemics. It just underscores this vital link. Animal health, human health, and the health of our shared environment are all interconnected. Managing health effectively on the farm isn't just about economics or animal welfare, it contributes directly to public health. So collaboration between vets, doctors, public health officials, producers, it's absolutely essential for a sustainable, healthy future for everyone.
What a journey through this complex world. We've gone from, you know, invisible bacteria causing subtle coughs to really dramatic neurological diseases and these surprising deep connections back to our own health. And that whole salt poisoning thing. How something seemingly simple, like water access, can have such devastating, completely counterintuitive effects if you don't understand the biology. It really makes you wonder, doesn't it? What other fundamental systems, maybe in animals, maybe even in ourselves, operate on principles that just defy our common sense? And how much more is there still to learn just by, looking a little bit deeper?